Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Croup is a common respiratory infection that primarily affects young children, typically those under the age of 5. It causes swelling in the airways, making it hard to breathe, and often leading to a distinctive, harsh cough. Imagine a tiny balloon, the airway, getting squeezed, making it harder for air to pass through. This constriction is what makes breathing difficult. This is what happens in croup, where the inflammation and swelling narrow the airways. Croup is characterized by a distinctive barking cough, often described as sounding like a seal. This cough can be alarming for parents. This sound is caused by the narrowed airways vibrating as the child tries to breathe, creating a harsh, raspy noise. Along with the cough, children with croup may also experience a high-pitched whistling sound when they inhale, known as stridor. This can be particularly noticeable at night. Most cases of croup are mild and can be managed at home with simple treatments like keeping the child calm and using a humidifier. With proper care, symptoms usually improve within a few days, allowing the child to return to their normal activities. However, it's important to seek medical attention if you are concerned about your child's breathing or if their symptoms worsen, as severe cases may require medical intervention. Understanding croup is the first step towards effectively managing it. Educating yourself about the symptoms and treatments can make a big difference. By recognizing the signs and seeking timely medical advice, parents can help their children recover quickly and comfortably, ensuring their well-being. Croup is primarily caused by viruses. The most common culprit is the para-influenza virus, responsible for up to 80% of cases. Other viruses that can lead to croup include influenza virus, respiratory syncytial virus, and adenovirus. These viruses are highly contagious and spread through respiratory droplets released when an infected person coughs or sneezes. These droplets can land in the nose or mouth of nearby individuals, leading to infection. Croup is most common in young children, typically affecting those between 6 months and 3 years of age. This is because their airways are smaller and more easily narrowed by inflammation. Children who attend daycare or have older siblings are at increased risk of exposure to these viruses. While most children experience mild cases of croup, certain factors can increase the severity. These include a history of prematurity, underlying respiratory conditions like asthma, or a weakened immune system. Croup typically starts with symptoms similar to the common cold, such as a runny nose, sore throat, and mild cough. These initial symptoms can be quite misleading, making it hard to distinguish croup from a regular cold at first. However, within a day or two, the characteristic symptoms of croup emerge, becoming more apparent and distinct. The hallmark of croup is the barking cough, which can be quite alarming for parents to hear. This distinctive sound is caused by the narrowing of the airways due to inflammation, which restricts airflow and creates the barking noise. Parents often describe it as sounding like a seal bark or a dog barking, which can be quite unsettling. Along with the cough, children with croup may also have stridor, a significant symptom to watch for. This is a high-pitched whistling sound heard when the child breathes in, indicating a more serious level of airway obstruction. Stridor is a sign that the airways are significantly narrowed, and it requires close monitoring. Other symptoms of croup can include fever, hoarseness, and difficulty breathing, which can vary in intensity. The severity of symptoms can vary, with some children experiencing mild cases, while others have more severe breathing difficulties, necessitating medical attention. It's important to note that croup symptoms often worsen at night, making nighttime particularly challenging. This can be distressing for both the child and parents, so it's helpful to be prepared and know what to do if your child develops croup. Having a plan in place can make a significant difference in managing the symptoms effectively. Diagnosing croup typically involves a combination of a physical exam and a thorough review of the child's medical history, which helps in understanding any previous illnesses or conditions that might be relevant. Doctors will listen carefully to the child's breathing, paying close attention to the characteristic barking cough and stridor, which are hallmark signs of croup. They will also examine the child's throat and nose for signs of infection, such as redness or swelling, which can indicate the presence of a viral infection. In most cases, the diagnosis of croup can be made based on these clinical findings alone, without the need for extensive testing. However, in some situations, further investigations might be necessary to rule out other conditions. For instance, if the doctor suspects a bacterial infection or another respiratory condition, they may order a chest X-ray to get a clearer picture of the child's lungs. The X-ray can help rule out other potential causes of breathing difficulties, such as pneumonia or a foreign object lodged in the airway, which can present with similar symptoms. Additionally, blood tests or viral swabs may be taken to identify the specific virus causing the croup, which can help in tailoring the treatment plan. Prompt diagnosis is important to ensure appropriate treatment and prevent complications, such as difficulty breathing or dehydration. If you suspect your child might have croup, it's crucial to seek medical attention promptly to ensure they receive the care they need. UMCC, your ultimate medical consultant connector.